diagnosis and plan based on a poor and incorrect assessment, resulting in inappropriate actions and evaluation, thus making the nurses bear a great deal of responsibility for ensuring that they have the requisite skill sets to execute accurate evaluations on all patients. So for our main objectives, after 2 hours of physical assessment, the student nurses will be able to obtain baseline physical and mental data, analyze health data, and interpret the result of the physical assessment. So for our patient's general data, here we have our client Tatay Dems, a 74-year-old male born on May 14, 1948. His height and weight are 55 kilos and 129 centimeters. Temperature is 36.5, pulse rate is 64 BPM, respiratory rate is 18 CPM, and blood pressure is 120 over 80. Thus, his vitals are within normal results.
So for this skin, for the inspection, it is eventually distributed. The skin color is pale brown. For the palpation, the skin temperature is warm. And the interpretation, the older client's skin became pale due to decreased melanin production and decreased dermal vascularity according to Kelly and Weber 2018. For the inspection, there is no lesions are present. For the palpation, the skin is thin, dry, and flaky. For the interpretation, aging makes skin more susceptible to dryness. Dry skin in older adults can be simply a sign of age-related skin changes or signify underlying medical problems, according to Lazar and D. Also, there is no odor of perspiration is present. For during the palpation, the turgor is normal. It springs back in less than or more than seconds. Nag turgor kami sa clavicle part. Also, sa interpretation, body odor is a very common issue that can affect a person's quality of life. It occurs due to bacterial process in sweat and due to sweat itself. And then the skin is intact and there are no reddened areas observed. So the interpretation, color varies based on the race and environment effect. Few moles are areas of depigmentation can be encountered. Also, our client has a tattoo. It's located siya sa left arm and also has moles. So, tattoo may make it difficult to evaluate moles. Tattoo ink can hide suspicious changes in moles. Next is the hair. So our client has gray hair is observed. Hair graying is a hallmark of aging, generally believed to be irreversible and linked to psychological stress. Next is thinning of hair is observed. Older clients have thinner hair because of a decrease in hair follicles, according to Kelly and Weber 2018. Hair feels coarse and drier.
So for the inspection of the nails, nails are clean and manicured. Nails are, for the palpation, nails are thick and brittle. And for the interpretation, nail health is closely associated with how well your body is functioning in other areas. And nails are attacked in the epidermis. And during the palpation, the capillary refills return to its original color after the pressure has been applied. Then interpretation is thinning of the epidermis is visible as the epithelium transitions to the nail. Then for the inspection, yellowness in the nail is visible and Older clients' nails may appear thicker, yellow, and brittle because of decreased circulation in the extremities.
So for the head and face during inspection, head is round, erect, maintained alignment with the midline and appropriately related to body size. For palpation, there's no swelling, no tenderness, and no crepitation with temporomandibular joint movements. So the head is normal cephalic, an indication of normal findings according to Weber 2018, and the skull has no nodules or masses and depressions when palpated. The face of the client appeared smooth, no lesions, and has uniform consistency and with no presence of nodules or masses. Now, next is good condition of the scalp and no presence of any foul odor. Also, mouth opens and closes fully 3 to 6 centimeter between upper and lower jaw laterally. And there is no motor deficits noted. The glossopharyngeal nerve or the cranial nerve 9 is functioning. Also, temporal pulse is palpable. Hair is diversely distributed and the temporal artery is elastic and not tender. So because of aging, the hair is not thick and it is also white. The strength of pulsations of the temporal artery decreases due to aging according to Kelly and Weber 2018. There is also no lesions visible and the head of the client is free from lice, nits, and dandruff. And if ever there are lesions that do not heal, it may indicate cancer according to Kelly and Weber 2018. Now, although with wrinkles, good facial features are observed and client has notable expressions. So facial wrinkles are prominent because subcutaneous fat decreases with age, according to Kelly and Weber 2018. Now for the eyes are symmetrical and excuse me. Upon palpation, there is no tenderness. For interpretation, eyes are symmetrical, eyebrows and lashes are evenly distributed. The client's eyebrows are symmetrically aligned and showed equal movement when asked to raise and also lower the eyebrows. There is also no presence of discharges, no discoloration, and lids close symmetrically. The bulbar conjunctiva appeared transparent with few capillaries evident. The sclera appears white. The palpebral conjunctiva appears shiny, smooth, and pink. Cornea is transparent, smooth, and shiny, and the details of the iris are also visible. The client also blinks when the cornea is touched. So there's
So
also
moving on.
there is also no redness and no drainage on lacrimal glands, no weakness in eye muscle, and upon palpation there is no edema. So there was no presence of discharges in the client's eyelids, no discoloration, and lids close symmetrically with involuntary blinks approximately 15 times per minute.
Okay, moving on. The client has a good visual fields and acuity. The client was able to read the Snellen eye test chart held at a distance of 20 feet. The client has a visual acuity of 20/40. And according to the vision care, a client who has 20/40 can see the same amount of detail from 20 feet away as the average person would see from 40 feet away. And this is also evident when the client sang his favorite song during the karaoke time where the projector is distant from him and he can sing the lyrics correctly. And next is for the pupils. The pupils are equal, round, reactive to light, and it can also accommodate. The pupils of the eyes of the clients are black and equal in size. The iris is flat and round, and the pupils equally round respond to light accommodation. And when it's illuminated and non-illuminated, pupils constricts, and pupils constrict when looking at near objects and dilate at far objects, and also pupils converge when the object is moved towards the nose. So next is for the ears. Upon inspection of the ears, the size is equal, and when palpating, the auricle, tragus, and mastoid process are not tender. The auricles are symmetrical and have the same color as his facial skin. The auricles are aligned with the outer canthus of the eyes. When palpating for the texture, the auricles are mobile, for firm and not tender, and the pinna recalls when folded. And also the angle of attachments, the auricle aligned with the corner of each eyes. And we also note that the color is consistent with facial color and no discharge just is present, and also no lesions, lumps, or nodules. And lumps and lesions that do not heal may indicate cancer. So the client has no lesions and lumps, so we conclude that he has no indications of cancers. And assessing the client hearing is challenging for us, given that the factor is having loud environment that affects the assessment, but severely affected is the assessment on his ear. Both of his ears can't hear during the hearing test. Um, aging aging may be due to many years of exposure to sounds that can damage inner ear cells. And yeah.
Okay, so for the nose and sinuses, nose are symmetrical. There are no tenderness of when palpated. Findings, the color of the nose is the same as the face. There are also no signs of tenderness in the frontal and maxillary sinuses. There is no drainage, and there is no discoloration observed in the frontal and maxillary sinuses. Findings on the nose and sinuses are all normal. So for the mouth and throat inspection, tonsils and uvula are present, pinkish and symmetrical. There are also no discoloration in the gums and palates. All are pinkish with no signs of lesions or ulcers. So for the teeth of the mouth, only one canine tooth in the upper jaw is present. So for our interpretation, the client might have periodontal disease. It is characterized by receding gums, wobbly teeth, and deterioration of the jawbone, and is the primary culprit in tooth loss among older adults. To continue, both upper and lower lips are thin and brown in color, and for palpation, tongue is moist and moderate in size. In addition, the client is also able to swallow without any difficulties or pain as he ate the distributed meriendas during the exposure. Thus, the internal mouth is normal. Internal and external mouth is normal with no abnormalities found.
So during the inspection of deformities, external skin changes, or signs of trauma, the client showed coordinated smooth head movement with no discomfort. During the palpation, the trachea is in midline and there's no lesions. Interpretation, positioned at the midline without tenderness and flexes easily. No masses palpated. Coordinated, smooth movement with no discomfort. Head laterally flexes head laterally rotates and hyperextends. No lesions is present. Lumps and lesions that do not heal may indicate cancer. And there is no obstruction or occlusions observed in the carotid arteries and jugular veins.
So for inspection, spinal curvature is visible. For palpation, there are no visible pulsations on the aortic and pulmonic areas. There is no presence of hips or lifts. For percussion, there is a full and symmetric expansion, and the thumbs separate 2 to 3 centimeters during deep inspiration when assessing for the respiratory excursion. For auscultation, the client manifested quiet and rhythmic and effortless respirations. The spinal curvature has the same characteristics or as the kyphosis, which is an increased curve of the thoracic spine. It is common in older clients. It results from a loss of lung resiliency and loss of skeletal muscle. However, it might indicate normal findings. For interpretation, there were also no crackles, wheezing, and pleural rub, and the client has normal breath sounds without dyspnea. To continue, for an inspection, the chest wall is intact with no tenderness and mosses, and good skin conditions with freckles and moles are observed. The vast majority of moles are not dangerous. Moles that are more likely to be cancer are those that look different from other existing moles or that the first appear after age 25. So breast, abdomen, and genitourinary is not performed.
All right.
Sir.
First slide, please.
Should you have questions, clarifications about the physical assessment of the group 5?
Let's start with ano siguro sir doon sa may initial data nila. Third slide. Second. Yan.
Okay, the skin. Normal integer, it returns back in 4 seconds. So it's a normal position. Normal, abnormal. Answer. Type in the chat box.
Normal po.
Normal. What is the normal skin turgor?
Please answer.
If elderly po kasi, according po dun sa knowledge po namin is, kaya po siyang up to more than 20 seconds po mag-return po yung trigger. So, we assume po na normal po yung findings po.
Ito yan siya, ma'am, si Kelly and Weber in 2018. Siya ang nagsabi na when aging, normal ang skin turgor na more than more than 2 to 3 seconds. Okay, ma'am. Sa anong meron doon? Sa Google? Okay, so you kindly search on this kung normal ang turgor na 4 seconds when an elder. Next slide, please. Has tattoos in the left arm. Color varies based on race, environment. Okay, next slide. The skin is thin, dry, and flaky. Dry skin in older adults can be simply a sign of age-related skin changes or signify underlying medical conditions. Ganun lang. Hindi siya, it's because decrease na ang subcutaneous fats. Flaky because dry. Okay, in all areas of the body. Ma'am Sindiko. Okay, paki-indicate na lang ma'am na presence of dry and flaky skin in the upper and lower extremities. Okay, next slide please. Gray hair is observed, thinning of hair is observed, hair loss from the periphery of the scalp and moves to the center. Hair loss from the periphery. Is this baldness? Are you trying to describe baldness? in the hair loss from the periphery of the scalp towards the center.
Yes po, sir.
Okay, thank you. Next slide, please. Nails are clean and manicured. Okay, are thick and brittle. Ma'am, kindly expound on this. Thick pero brittle. Can somebody explain that?
Yung nail bed niya po kasi sir, parang matigas po siya sir.
Tapos,
Pero brittle siya. I mean, yeah.
how did you assess na brittle siya, sir? Nails are clean pero may yellowness.
Sir, sa brittle daw po na part, sir, kay yung nails niya daw po is may guhit-guhit po.
May guhit-guhit. Is that what you mean for brittle? Baka ganun talaga ang kamay ni sir. Ang texture ng kamay niya, hindi shiny, kundi may mga lines. What do you mean by yellowness? Bakit may yellowness?
Yung nails niya po sir, yellow po siya, nag-appear na color.
Is it the nail beds? Hindi.
Yes po, yung nail lang po. Pero dili itong color.
Hindi beds. You know what is nail bed?
Yes po.
Okay, so ang kuko lang ang yellow, not the nail beds.
Yes sir.
So what is the color? What is the color of your nail beds?
Sir, correction po, yung yellow po is na-found po siya sa nail bed, sir. Po, yes, sir.
No?
Sa nail bed siya, sir.
Nail bed. Anong color ng nail bed?
Slightly yellowish po siya, sir.
Slightly yellowish. Sir,
Yes, sir.
ano tayo, pink? Kakamping tayo or dilawan?
Pink po, usually ang your normal findings po, sir. Pero sa kanya po, sir, is yellow, sir.
In the case of your patient, yellow siya. Bakit siya nag-yellow, ma'am? What could have been the indication?
According to our interpretation po, sir, is maybe because of decreased circulation po, sir. Or in some cases po, jaundice po.
Pero in your palpation, the color returns in less than 2 seconds when blanched. Okay, you kindly try to this data, ma'am, ha? Mag-coincide sila. Next slide, please. Head is round, erect. Ayan, erect. What do you mean by erect?
Yung position po, upright position ng head. Hindi po siya parang duko po yung head ni tatay.
But you kindly check this one, ma'am, ha? The erected na head. Kasi normally, naka-align naman talaga yan na straightforward ang ulo. Pero hindi yan siya naka-erect. Kasi when you say erect, iba ang definition ng erected. No, it would pertain into other idea. Okay. Then, the appropriate related to body size. Meron ba talagang appropriate na head circumference to the body size?
Ano po, sir, yung meron po kasi ibang tao, sir, di ba, na mas malaki po yung ulo nila kaysa sa, hindi po normal yung pagkalaki ng ulo nila sa size ng katawan po nila.
That is in the case of your pediatric patients, ma'am, wherein the fontanelles are still open and has the chance na magka-hydrocephalus. But the case of your patient, tigulang na siya. Kahit pa magka-hydrocephalus siya brought about by, halimbawa, nagka-infarct siya, nagka-cerebrovascular accident, nagka-bleed. Ang iba nagkakaroon ng hydrocephalus. Pero hindi lumalaki ang ulo nila. Nagkakaroon lang ng fluid accumulation in the brain, but the size does not matter. So you kindly consider that one. No, na ang statement nyo appropriately related to the body size. If you will tell me sa pedya, ganyan ang pagka-state ninyo, I would accept. Because pediatric patients, normally dapat ang head circumference nila is related to the body size. Kasi pag lumaki ang head nila more than the body circumference, that could mean another problem. Okay, like other group, the good condition is a subjective findings. You kindly restate this one into an objective data. What made you say na good condition ang scalp niya? Manifestations, no like that. Mouth opens and closes fully. Wow. The mouth opens and closes fully 3 to 6 cm between upper and lower jaw laterally. Is that normal?
Yes, sir.
Okay. Okay. Be able to provide your reference for this one, sir, ha? Next slide. Hair is diversely distributed. Wow. Diversely distributed. Hindi siya evenly, kundi diversely distributed. Pero there is baldness. Tama? How can we
Yes.
reconcile? May naupaw siya pero diversely distributed.
Opo, sir, parang ang ibang area lang po, dito parang wala na. Tapos, ang iba, kung diverse, parang may hair pa rin po, visible.
Okay. Siguro you can use term na hindi diverse, siguro, sir, ha?
Pa-reinstate na lang pala natin yan kasi parang magkasalungat talaga siya.
Oo. Consider the baldness in the assessment on your hair kanina. Is elastic and non-tender. The temporal artery is elastic and non-tender. How did you assess the elasticity of your temporal areas artery, sir? Did you try to move it like this? You move it from left to right side, tapos elastic na siya, or you just twist the artery? Yes?
Parang, ganun.
How did you assess the elasticity of your artery? Normally, your artery will become elastic if the pressure is high because it will cater the pressure brought about by the blood. Pero eventually, it will burst if hindi na kaya. Pero again, my question is, how did you assess the elasticity of your temporal artery? Okay, next. Eyes are symmetrical, no presence of discharges or no discoloration, and lids close symmetrically. Next slide. No redness, good visual fields. Again, your good is subjective. Kindly elaborate that one. Next. Pupils are equally round. What is the pupil size?
Within normal range.
Ma'am?
4 mm po, sir.
4 mm. So with 4, what is the normal pupil size? 2 to 3, tama? 2 to 3 millimeter. 4 mm. So medyo malabo ng paningin ng patient ninyo. Pero you stated in the previous slide na good ang visual field and visual acuity ng yung patient. Okay, so kindly consider that one. Next. Sa 3 to 5?
Yes po, sir.
3 to 5. Okay. Sige. Next, ears are equal in size. The auricle aligns with the corner of each eye. What corner of your eye, ma'am? The
Outer canthus.
outer canthus. So, ilagay nyo dyan. The auricles are aligned with the outer canthus of the eye. The mastoid process are non-tender. Okay. Next. Color is consistent with facial color. No discharge is present. Both ears can't hear during the hearing test. What test? Kindly identify anong mga test ang ginagagawa ninyo, sir.
Whisper test po. Tapos,
Okay. So, unable to hear on both, unable to hear during yung mga assessment procedure ninyo. Next slide. Symmetrical. Nose is symmetrical. Again, what do you mean by this? Ano ang symmetrical sa nose ninyo? Findings on the nose and sinuses are normal. Saan ang symmetrical sa nose? Okay. Next, there is no discoloration observed in the frontal and maxillary sinuses. Ayan na siya, na-state na siya sa second column ninyo. No signs of tenderness. The color of the
Students, can you observe any discoloration in the frontal and maxillary sinuses? Are the sinuses visible? Visible ba ang ating sinuses, students? Are they
No
visible?
po, ma'am. Pero,
Bakit nakalungan there is no discoloration observed in the frontal and maxillary sinuses?
na-misphrase lang po siya kasi we use transillumination po, ma'am. Tapos, wala pong black or darkness po. Ay, wala pong mga black na spots po na hanap po doon sa pag-check ng sinuses.
Okay, sige. Okay, sige, let's go to the next one.
slide,
Okay, so-
please.
So tonsils. Sige, sir.
Symmetric ka. Ay. Tonsil siguro. Tonsils. Makita ninyo ang tonsils, ma'am. Pinkish. Pag makita bang tonsils, hindi siya enlarge? Makita bang tonsils kung hindi siya enlarge? Nakita ninyo ang tonsils, students? Hello? Nakita ninyo ang tonsils?
Students, please answer. Yes or no?
Hindi daw.
Ha? Hindi.
Hindi daw po.
So,
Ayan,
tanggalin.
Hmm.
Remove pa yung mga hindi na-perform. Please remove it. Yung nagawa lang, yun ang ilalagay.
Uvula, symmetrical. Isa lang ang uvula. Okay, only one canine tooth in the upper jaw is present. Lips are thin and brown in color. The internal and external mouth is normal.
Okay.
Okay.
Sige.
Look, or that's your interpretation, ha? Lips are thin. Is it normal, abnormal?
Normal person.
Okay, next slide.
Deformities.
Is change the soma, no lesion. There is no obstruction or occlusion observed in the carotid arteries.
No lesions. No obstruction or occlusion observed with the carotid. The obstruction of your carotid artery, kailangan po natin dito ng invasive procedure, ha? Please remove that kasi hindi man kayo nag-perform doon ng nag-insert kayo ng catheter doon sa femoral artery ng inyong pasyente or nag-cardiac testings kayo, wala man yung ganun. So, ginagmin nyo lang visible siya, di ba? Nakikita nyo ang kanyang carotid artery and jugular vein. Yun siguro ang ginamin ninyo dito. Kasi kapag sinasabing obstruction and occlusions, doon na yun sa interpretations talaga. But however, sa inspection nyo, nakikita nyo lang. Ano ba? Nakikita nyo ba doon ang linya na yun ng carotid artery? Yan. So, yan lang po ang kailangan natin. Then kindly interpret that. Sige.
Okay, next slide.
Next slide. Thorax map.
What do you mean when it's found in this spinal curvature is visible? What do you mean by this one, ma'am, sir?
Yung back, parang gaya po siya.
Nag-slouch.
Opo.
Loud. Sir, is that visible na?
Yes po, sir.
Hindi dapat, inspection, you should not be able na, hindi dapat ganyan ang pagka-state. No? Again, yung description ng kyphosis ang ilagay nyo dyan sa inspection ninyo, na kanina na meron din kyphosis. Diba ang definition ng kyphosis is outward na direction ng spine, no more than the normal. So yun yung pagkalagay nyo dyan sa inspection, hindi na visible. There were no visible pulsations, okay, the presence of hives or leaf. There is full and symmetric expansion of the tops. The client manifested quite rhythmic and effortless respirations. What is the respiratory rate of your patient?
18.
18 po.
Cycles per minute. Normal, abnormal?
Normal.
Po.
Kindly enhance your inspection na data, ma'am and sir. Next slide, please. The client, the chest wall is intact with no tenderness. Okay. And,
Good skin condition.
describe this good skin condition, sir.
Ano itong freckles na ito? Is this yung client ba natin ay may dugo or lahing Caucasian or anong nakikita ninyo? Baka liver spots. 'Di ba? Hindi siya freckles. Okay, so you have to quantify and qualify that, ha? Kasi nakita ko yung patient ninyo, remember? Okay? So, ayan. Mole. Saang banda? You have to include that. Good condition siya, pero may mole at saka may mga liver spots, for example, kasi sinabi nyo nga. So, hindi siya good condition, right? Or ano ba? Part siya ng aging process. So, you have to state it that liver spots are seen located at ganito, the upper extremities, at the lower arm, ganon. Be specific, okay? Then kindly write your interpretation. Sige, next slide. Abdomen, genital, not perform, extremities, gait, able to walk and balance. Sige. Next. muscles. No swelling or redness ng kanyang muscle. Upper and lower extremities are both equal in strength. Climate spine, curve outward. Outward. Napalabas ang spine. Outward. Imagine ko siya kung paano outward ang spine. Yung spine natin is not part already of your extremities. Na-describe nyo na siya kanina, di ba? You have to remove that here. Assessment of the muscles na po tayo dito. Okay? So, hindi siya applicable dito. At saka na-mention na natin siya in the previous findings. Walang tenderness upon palpation of your muscles. May masses siya. May lump. So, itong lump na to malaki ba? Gano'ng kalaki? You have to indicate it. Kung gaano siya kalaki, around 2 to 3 cm ba siya? Gano'n siya kalaki. At saka saan siya located. Diba? So, posteriorly, andun siya. Dapat andun yan, may lump located posteriorly. Ganun ang pag-state. Dapat medyo anatomically ba? Gamitin natin yung mga terms na yun, hindi yung back of the spine, ganun. Posterior, anterior, lateral, di ba? Ganun po yung kailangan nating ilagay dyan. So kindly improve that. Percussion. Tenderness, ang tenderness is a palpation yan, di ba?
Yeah.
Ang percussion is sounds ang kailangan natin dyan, or vibrations ang kailangan natin. Saan na to si Mr. Soria? Joshua?
Yes, opo.
Sige. Check that. Kasi nakita ko yung pasyente niyo again. Okay? And your interpretation, please quantify and qualify that as well based on your IPPA. Sige, next slide. Still, the same lang ata, except for the palpation. The same lang ata. Okay. Sige, move na tayo doon. Sige, next slide. Sa joints, clients, ROM hindi ROM. ROM ang pagbasa po niyan. Good. Nagsabi na kayo ng good. Interpretation na po yan. So you have to, yung previous group, yung kapag narinig niyo yung mga inayos natin, yun din po dapat ang ayusin ninyo dito. Huwag na magsabi ng good and no signs of pain. No tenderness or absence of pain, ganyan. Kasi usually sa interpretation na yan eh. The client does not fall backward. Ano ibig sabihin nito? Hindi siya matumba? Palikod? Ano ni?
Kasi po, ano po siya yung parang tinulak po.
Tinulak niyo siya? Bakit siya tinulak? Yun yung term. Okay? Nag-perform kayo, nung nag-check kayo ng resistance niya, ng strength niya, if it's, kung strong ba ito or weak. So yun ang description dapat doon. Hindi the client does not fall backward kasi para siyang matumba siya, parang tinulak siya, di ba? So change that, No clicking sensation in the temporomandibular joint when palpated. Clicking sensation. Anong ginamin sa clicking sensation ninyo dito sa joint na ito? Kasi kung sound ang ginamin nyo, sa percussion yan. Kung palpation kasi, usually tenderness, the shape, yan yung kailangan natin dyan, di ba, pag palpate. Yung sound nga, percuss yan siya kasi nga, di ba, nag-strike tayo. Miss Endico? Yes. So yun ang ginamin ninyo na walang clicking sound. Isipin ko. Sige. Isipin ko muna yan. Sige, kasi sa akin naman kayo mag-submit. Sige, isipin ko yan. Interpret nyo lang ng maayos. Sige. Yung tenderness sa percussion, ang knee during... Okay. Hammer ang ginamit dito. Okay, sige. Next. Thank you. Okay, congratulations, Section D. Let's proceed with Section E. Thank you so much. Let's give a hand to Group 5 sa wakas. Mga alas 11 tayo matatapos nito. Anyway, let's proceed with group number 5 of Section E. Who's Group 5 of Section E?
Wala pong 5, sir.
Ay, tama pala. Sorry lang. 30 lang pala kayo. Group 4.